I think when you're in positions like being president of the Academy, you need to be able to have your ears working really well so that you can hear what it is that people need, whether they are able to express it or not express it. Because ultimately what you end up being in a position as president of the Academy is a real voice for expressing what those that you are representing want to have happen. If you ask the patients what the crisis is the accessibility of care, the ability to even be able to get into the physician's office or the ER or wherever they need to be to get quality care. If you speak to the physician, especially the family physician, the crisis is in being paid for what you're doing, the incredible poor reimbursement that they're getting through the healthcare system for the care they give, and the high and increasing overhead and hassle factors that play on the other side of the ledger. And then if you talk to the Academy as an organization and look for what are the crises that we're dealing with, the crises we're dealing with are defining our role within the organization of medicine, and where we fit as an academy, and how and what we want to do for our members going forward over the next few years. So, you know, if I take a look at it and answer that question ultimately by what my challenge is, if I'm going to be in the position of president of this academy, I need to incorporate the crises as they exist from all of the things that I mentioned before. Ultimately, what I see as my biggest challenge is how do I make what we're doing in the academy relevant to our membership and important to our membership so that they want to be members of the academy, so that they look at the academy and see it as the spokesperson or the spokesman in general for what their needs and wants are as academy members. And that's where the challenge, I think, exists for those of us in leadership in the academy. I believe that having a good family doctor at the center of the system helps you as a patient to be able to get the care that you need to get. You know, listen, I've been through it with my father's death. You've been through it with your dad. We've been able to see what happens when you don't have that family doctor there advocating for you and your family and everything you want done. I mean, I'm a family doctor, and one of my brothers is a family doctor. I got 3 other brothers that are in the healthcare system, and we still couldn't manage to navigate the system the way it needed to be navigated properly. What a medical home allows to happen is for the physician that's caring for the patient to really know the patient and to make sure that the patient gets the things out of the medical system that the patient needs to get. When you don't have a medical home as the center of the system and it's basically being run haphazardly, then you have no guarantee that's going to happen. In the healthcare system, that either we put the family doctor to healthcare in the center of the healthcare system, make sure that everybody has a medical home and they use the medical home in the appropriate manner. And that medical home can be a pediatrician, can be an internist, can be an oncologist, can be a nephrologist, depending on the disease that the patients have, or it can be a family doc, which is what everyone should have. And I'm not saying that a PA or an NP can't provide good quality care. I mean, they can. But, you know, I think that we are perched on the precipice of a decision that needs to be made in this healthcare system in the United States. How are we going to get electronic medical systems into every family medicine office in this country? How are we going to allow them to provide the care they need to? How are we going to allow them to be paid the proper amount they need to be paid that'll allow them to work? That's where our challenge lies, I think, in the next few years, is being able to find a system that pays your family physician the proper amount to allow them to be the best doctor they can be and take care of 90 to 95% of what comes into their office. As long as we pay them what we pay them, we probably can't expect them, many of them around the country, to be much more than triage physicians. So, you know, the responsibility lies on all different parts here to make the system better. We got to pay the family physician better. We got to train them better so they can provide the services they need to provide. And we got to be able to do things that encourage the young physicians in medical school that encourage the young kids that are in college to want to become a doctor and want to become a family doctor, because that's what's going to allow them to do something that makes their life worthwhile.